Something that's really scary and something that women do not ever want to talk about. Menopause. I know a lot of you are just shuddering at the fact. In fact, I was just telling producer Bree, I was convinced after I had my daughter, I'm 41, that like, ooh, was I doing that perimenopause? You know, you're getting hot, you just don't know. So I went to my OB and I was like, hey, run every test for my hormones to make sure that I'm not in that perimenopause, whatever the heck that means. Well, I just want you to know, probably TMI, but you guys know I'm an open book around here. I got it written. Nope, mama's not in perimenopause, I'm not in menopause, just a lot of hormones going on. But ladies, this is something we have to deal with, right? And I think that it's something we need to talk about. We need to talk about these things because we're not alone. So often, women, we're going through these health things and we don't know what to do. So I'm very excited about our next guest because menopause is an issue that impacts millions of women, and yet, like I was just talking about, is often misunderstood. Well, joining us now to discuss is Dr. Alyssa Dueck, the Chief Medical Officer at Bonafide Health. Doctor, thank you so much for waking up with us. I was just telling all of my audience members that, yeah, I just got tested to make sure I wasn't in menopause or perimenopause because you just don't know what's going on with our bodies. So starting off, what are some of the common misconceptions regarding menopause?
Hello, and so nice to be here. You know, you bring up such a good point. One of the most common misconceptions is actually the definition of menopause itself. In fact, Bonafide runs a state of menopause survey each year, and this year we still found out that 7 out of 10 women are still unclear about the definition of menopause, and this goes to your story. So just to set the record straight, menopause means 12 consecutive months without menstruation after age 40. But to your point, years leading up to that time, which is called perimenopause or the menopausal transition, can still be a time where women are experiencing symptoms, and it can cause a lot of confusion and often a disconnect with what's going on.
Okay, thank you for clarifying because actually I did not know the definition of menopause. So often we think hot flashes, women are out of control hormonally. What are some of the things that can affect our day-to-day life when it comes to menopause?
Look, hot flashes and night sweats are definitely the iconic symptoms of menopause, and they actually do start in later perimenopause. But we're also looking at sleep disruption. We're looking at mood changes, including irritability, menstrual irregularities at the end of perimenopause. We also may see changes to our vaginal health. Our relationships may suffer as a result of that, and also work productivity because people can be a little bit uncomfortable during the day with some of their symptoms. The great news is suffering is kind of out, and treating and managing these symptoms is all the rage right now.
Okay, good. I was like, is there any good news or positive news when it comes to menopause? So what are some of the new treatment options?
Yeah, so the old standby hormone replacement therapy is still available. It is not for everybody, and many choose not to take hormones, so we do have lots of alternatives. There are other drug options that require a prescription, and you would visit with your gynecologist or a healthcare provider for that. And then there are over-the-counter, well-studied supplements. For example, Bonafide just released a newer supplement called Thermella. Very well studied clinically. In fact, we presented information on these clinical studies at the recent Menopause Society annual meeting, and we are seeing wonderful results with women seeing relief of their hot flashes and night sweats in as soon as 2 weeks. So there's really something for everybody, and everybody should consider lifestyle alteration to better their health: diet, exercise, sleep hygiene, etc.
So there is some light at the end of the tunnel of this journey.
Absolutely.
So where can we go for more information? Because I really like this, because I don't do well with that hormone. So I like that there's Bonafide, that you have options.
Absolutely. Please visit hellobonafide.com, chock full of information, not only about menopause and perimenopause, but about the supplements and our clinical studies.
Well, doctor, I hope you come back on the show. I really love having these open discussions because as women, so often we just don't talk about this stuff.
You got that right. Thank you.
Thank you, doctor. Have a great rest of your day.